Yale will now pay dozens of patients who sued the school after extremely painful egg retrievals at its fertility clinic following a nurse who was secretly, I should say, swapping their anesthesia with saline. And while Yale has since said it is committed to making changes to the way it handles narcotics, what does this case mean for Connecticut residents having confidence in our hospital systems and having health advocacy? Attorney Eric Chaffin of Chaffin Luhana, a national law firm with offices here in Connecticut, joins us now to give some perspective for us. And Eric, welcome back. Let's talk about patient advocacy. I suppose everyone needs to have an advocate if somehow incapacitated, and it would seem like that starts with your family and the medical team. Would you agree?
Yeah, I totally agree. One of the first things we tell our clients, many of whom are injured, is when you go to the doctor, try to have a loved one go with you. You just have someone who's able to listen perhaps on a deeper level, help you communicate the issues to the doctors and the staff, and hopefully listen to what they're saying.
And I'm curious, Eric, do you see medical malpractice cases that result from a lack of patient advocacy? And I don't know if this was a lack of patient advocacy, but I would think when you've got dozens of people saying, hey, I'm in so much pain, but they were refused. They were refused any different medications or even kind of checking to see if their claims were credible. Do you see these types of cases?
We do. When you look and you see that the third leading cause of death in the U.S. is medical malpractice, there's obviously a concern. We see in the system that there's a lot more people in the system handling cases beyond just doctors. And so we see people that are trained for a few years versus, 10, 12 years like a doctor. And so as a result, they just don't see as many things and see as many cases. And so if there's something unique going on, I think the propensity for harm to the patient is much greater. Just on a personal level, I was at a hospital about 18 months ago with a loved one, and the doctor in the ER wanted to do a spinal tap because of an infection. And I was there, and we insisted that the spinal tap actually be guided by radiology, and he really pushed back. Eventually, we got it done through a patient advocate, and then later we learned that the reason why is because he actually worked for a private equity group that was running the ER, and he wanted to do the procedure there because he was going to make more money. And so you see a lot of this. It's here in Connecticut, and I think the key thing for people is to be aware. And we all think of doctors as just having the patient's interest in mind, and a little healthy dose of cynicism. Not in all cases, but a little healthy dose of cynicism and asking questions is really important.
Well, and Attorney Chaffin, not for nothing, but you understand this. So you're a professional who has seen this. You have an educated background in this. And that's, I think, one of my concerns when you talk about patient advocacy and really understanding that, well, okay, maybe we have patient advocates on staff at many of our hospitals. That doesn't really do much. I myself was having my son back in July of 2018. Our entire hospital system in Vermont was on strike. And so for 3 weeks, all the regular Vermont staff they were all on strike. And so there I am going to have my kid. I have to have an emergency C-section done. It was a disaster. And after it was done, we had nurses coming in from all over the country to fill the gaps. And I was in such severe pain, Eric. I can't even tell you. But my mom, thank God, was there because she's a registered nurse for over 20 years. She was able to get them to believe my pain and to actually give me something. But if not for her being there, they were not listening to me as a reporter who worked in the health beat. They were not listening to my husband. They were not listening to anything we had to say. And so, talk about even the fact that you almost need to have a background in the medical field to sometimes get what you're asking for. It's not enough to even have somebody have a loud voice and be concerned. You almost need to know what you're talking about.
Yeah, no, and I'm sure you felt what many of our clients do. It's a very helpless feeling. And, it's frustrating to, like you said, to have that background, have somebody who's around you that's able to help you, but so many people don't. And so we certainly encourage people that there are patient advocates within the systems. There's social workers. If you feel like you're not being heard, if you're communicating like the women did in the Yale case where they're expressing this excruciatingly painful and their reality is being doubted by the doctors who clearly thought that it was fentanyl, but obviously there's a system within the hospital that was not protecting the fentanyl supply, and as a result, it got tainted by a nurse doing what she did. And so, there's such quick medicine now. The ability to slow down and actually listen, hear people, I think, is really difficult, and that's a basic human issue. And so the hospitals can do better. The doctors, some of them know they can do better. They expect more from the hospitals, but there's just so much pressure in the health system. And again, that's why we see the third leading cause of death in the U.S. is from medical malpractice.
And, it's interesting, Attorney Chaffin, a recent study suggested a lack of cooperation and ineffective communication between healthcare teams, care recipients, and the health institution, resulting in more complications, more negative consequences, and even death. Do you think there's a significant need for better patient advocacy?
Yeah, and unfortunately, there's so much of a need, and we see it whenever there's communication breakdown, lack of informed consent, the pressure to have more practitioners and others take over what traditionally doctors have been doing. When you look at the fact that differential diagnosis is how most diagnoses are done, which requires experience and understanding, and so communicating a particular symptom is really important, or a doctor hearing this particular symptom and knowing it in order to treat the patient effectively is so important. And so there is a lot of breakdown, and unfortunately, with the healthcare system we have, it's just getting faster. It's becoming more driven by economics, and and we see that across the states and different states with tort reform. And the reality is the tort law is what keeps the quality of care there, and I think we see that in many states. And I think when we start seeing legislatures lobby to change the laws, for example. Unfortunately, there's cases like Yale where, hold on a second, we have to step back and look at the system, what broke down, and there were system failures, which is why there was so much paid to the women in those cases.
And again, we so appreciate the insight of Attorney Eric Chaffin. And if you want to learn more information or certainly connect with his offices, you can do that online. You can also call their 24/7 hotline, 800-896-4336. They do have offices here in Connecticut, including one in Stamford. We thank you so much, Eric, for your insight on this case with Yale.